In this part of video tab course, we will introduce the second most common opportunistic fungus, Candida. The second most common opportunistic fungus is Candida. Candidiasis is a fungal infection caused by a yeast called Candida. Some species of Candida can cause infections in people. The most common is Candida albicans. Candida normally lives on the skin and the inside of the body, in places such as the mouth, throat, gut, and vagina, without causing any problems. Candida can cause infections if it grows out of control or if it enters deeply into the body. Some types of Candida are resistant to the antifungal used to treat them. Candidiasis in the mouth and throat is also called thrush or oropharyngeal candidiasis. Candidiasis in the esophagus is called esophageal candidiasis or Candida esophagitis. Esophageal candidiasis is one of the most common infections in people living with HIV and AIDS. Candidiasis in the mouth and throat can have many different symptoms, including white patches on the inner cheeks, tongue, roof of the mouth and throat, redness or soreness, cotton-like feeling in the mouth, loss of taste, pain while eating or swallowing, cracking and redness at the corner of the mouth. Candida normally lives inside of the body and on the skin without causing any problems. Sometimes Candida can multiply and cause infections if the environment inside of the vagina changes in a way that encourages its growth. Candidiasis in the vagina is commonly called a vaginal yeast infection. Other names for this infection are vaginal candidiasis, vulvovaginal candidiasis, or candidovaginitis. The symptoms of vaginal candidiasis include vaginal itching or saltness, pain during sexual intercourse, pain or discomfort when urinating, abnormal vaginal discharge. Invasive candidiasis is an infection caused by Candida. Unlike Candida infections in the mouth and throat or vagina, yeast infections, invasive candidiasis is a serious infection that can affect the blood, heart, brain, eyes, bones, and other parts of the body. Candida-mere, a bloodstream infection with Candida, is a common infection in hospitalized patients. Candida normally lives inside the body and on the skin without causing any problems. However, in certain patients who are at risk, Candida can enter the bloodstream or internal organs and cause an infection. A Candida bloodstream infection, also called Candida-mere, is the most common form of invasive candidiasis. In the United States, Candida-mere is one of the most common causes of bloodstream infections in hospitalized patients, and it often results in long hospital stays and death. It is also responsible for high medical costs. People who are at high risk for developing invasive candidiasis include those who have spent a lot of time in the intensive care unit, have a central nervous catheter, have a weakened immune systems, have recently had surgery, especially multiple abdominal surgeries, have recently received lots of antibiotics in the hospital, received total parenteral nutrition, have kidney failure or are on hemodialysis, have diabetes, are preterm babies. People who develop invasive candidiasis are often already sick from other medical conditions, so it can be difficult to know which symptoms are related to a Candida infection. However, the most common symptoms of invasive candidiasis are fever and chills that don't improve after antibiotic treatment for suspected bacterial infections. Other symptoms can develop if the infection spreads to other parts of the body, such as the heart, brain, eyes, bones, or joints. The tissue invasion by Candida albicans contains several steps. First step, the adhesion of Candida spores to the epithelium. Second step, the epithelial penetration and invasion by hyphae. Third step, the vascular dissemination, which involves hyphaeal penetration and blood vessels, and seeding of yeast cells into the bloodstream. Final step, the intestinal colonization and penetration during disseminated disease. The cellular invasion of Candida albicans contains two types. Firstly, C. albicans invasion of epithelial cells by receptor-mediated endocytosis. The C. albicans ALS3 and SSA1 invasions interact with E. cadherin and a heterodimer composed of EGFR and HER2, which activates the cadherin endocytosis pathway, resulting in the endocytosis of the fungus. Secondly, C. albicans invasion by active penetration, in which a progressively elongating hyphae pushes its way into epithelial cells. The specific type and dosage of antifungal medication used to treat invasive candidiasis usually depends on patient's age, immune status, and the location and the severity of the infection. For most adults, the initial recommended antifungal treatment is an echinocandin given through the vein, fluconazole, amphotericin B, and other antifungal medications may also be appropriate in certain situations. In this part of video type course, we generally introduced the symptoms, tissue, and cellular invasion and treatment of Candida. Next part, we will introduce you another opportunistic fungus called Cryptococcus. Thank you.